Hi, Nancy with the Hospice Care Plan. Today we're going to talk about defibrillators. It's often a point of anxiety and worry when a patient is admitted to hospice care and the family say, oh my gosh, what's going to happen about that defibrillator? And indeed, this is an issue that needs to be attended to. A defibrillator is actually part of an advanced pacemaker system that will shock the heart if it stops internally. It would be like going to the emergency room if there was a heart attack and they put the paddles on to cause an electric shock to get the heart going again. This can happen from the inside with an implanted defibrillator. We already talked about a pacemaker not being a worry, not having to worry about if it's a plain pacemaker. But a defibrillator needs to be attended to because this can be extremely painful for a patient when they're dying and their heart is trying to stop and the pacemaker as an appliance is trying to keep it going. It can be very, very painful, distressful for the patient and the family, of course. So when a patient is admitted with a defibrillator to hospice care, it's time to actually check with the physician in charge and to call the cardiologist to get this defibrillator disconnected or turned off. In the meantime, while those arrangements are being made by the hospice team, the hospice nurse generally should be carrying a very powerful magnet. These are two different magnets. They're very powerful. You could hear how quickly they connect with each other, and they can be used in an emergency to turn off the defibrillator. So, nurses, you should be carrying one of these, and it should be placed where it can be taken a hold of very quickly if something has changed during the active dying process. So many of the beds that we have in our facilities, Brenda reminded me, are made of metal. So you can attach this right to the headboard or the footboard, and if not, it should be taped somewhere where it is visible. You want this to be so someone could grab it in an emergency with a sign, perhaps, magnet on the bed or magnet, and it's taped to the wall or the dresser. What would happen in an emergency is the nurse would just tape this right over top of the device, and you can feel it under the skin. And it would be taped on the chest, and it would do the job in an emergency of turning off the defibrillator. If fortunately that this doesn't happen very often and there is time for the cardiology team to come, send a technologist who then comes and makes an appointment and turns it off, then the pacemaker will continue to function just like it always has, but the defibrillator is disconnected, so there will be no large, painful electrical shock during the defibrillating process or during the dying process. Make sure your families know this. It can be very, very frightening for them to not understand that this won't be something to worry about once the defibrillator is turned off. Please visit our website and look at all of our videos because we've got lots to help teach you, and we appreciate all of your care and good work.